Hi, I'm Megan Finnerty, and thank you so much for joining us. I'm with USA Today, and I'm your host of Coronavirus Conversations. I'm obviously here from my home in Phoenix, Arizona, where you might hear my 5-month-old son or maybe my husband who's looking out for him right now. Right now, we're going to bring you a show filled with reporters and experts from across the country and the USA Today network, all about talking about the most urgent questions that you've been submitting for the last several weeks. I'm going to bring up our guests right now so you can say hi to them. Mark Johnson of the Milwaukee Journal Sentinel will talk to us about what treatments are being worked on and what the pipeline looks like for a cure. Ken Altucker of USA Today on testing updates. He's going to let us know where it's happening and what's on the horizon. Dr. William Schrank, he's the Chief Medical Officer at Humana, who will talk to us about what insurance companies are doing to help you out. And we'll hear from Chris Bianco, one of the nation's most beloved pizza makers, to talk to us about how small businesses are navigating this new world while they wait for stimulus money. Thank you, gentlemen, for being on the show today.
Thank you for having me.
Thank you.
I appreciate you being here, and I appreciate you guys watching with us. USA Today has put together this show because we are on a mission understanding that facts fight fear. We are bringing this to you weekly with the help of our more than 5,000 journalists from across the network to help provide you context, help, thoughtfulness, and community in this time as we're all adjusting to what I think is like a pretty weird new normal for all of us. It's everyone's job to share and report the truth, and we are here to empower you with that. We're not here to talk over each other, get wonky, or get weird. No one needs that kind of stress. And so instead, we're going to dig into the issues of the day and the questions that you've asked us about the most. We are here to build community and spend time with you, even though I know that it's all virtual. We're going to start with health and science because that is where most of your questions continue to be focused. I'll bring up my colleague, Mark Johnson, again, of the Milwaukee Journal Sentinel. Mark, you've been writing quite a bit. Thanks for being on.
Thank you.
First of all, thank you. It does look like you've been writing a lot from your home. So first, tell me, how's it going at home?
Well, first of all, welcome to chilly Fox Point, Wisconsin. I'm reporting stories on the first floor. And on the second floor, in what used to be my son's bedroom, my wife's editing a national magazine. And very confused are our two animals, a cat named Zunder and a dog named Brune, who don't understand why on earth we're home this time of the day.
Just filling up their space, I'm sure. Well,
yeah.
Thank you so much for being here. I know you've been reporting on a new experimental plasma treatment, which is exciting, but also I'm sure like very, very on the cusp. So tell us what's going on.
Well, it's in some ways it's not all that new. It's using a technique that's over a century old. It's called convalescent plasma, which means basically it's taking plasma from people who've already recovered from a disease and using that plasma, which has very rich antibodies, to then help somebody who's sick with that same disease. Now, this has been used since for over a century. It's been used to help stem outbreaks of poliomyelitis, measles, mumps, and influenza. But there's a very big movement now, over 100 doctors and scientists involved, 40 large hospitals around the country in 20 different states, all pushing to get clinical trials started for plasma from COVID-19 patients.
That's so interesting. Can you tell me a tiny bit more how it works? Like they gather the plasma and then how would I ultimately end up getting treated with it?
Well, actually, I should say too that it's in some ways it's already being used. The FDA has allowed this for compassionate use. In other words, in emergencies when nothing else will help. Basically, what it is they take blood from patients who have recovered from COVID-19, and they sort out the blood bank will usually do this. They sort out the plasma part of the blood. That's what has the antibodies that have been built up against this disease. That blood would then be, or the plasma would be checked to make sure that it doesn't have any bacteria or other viruses. And you would then get an infusion of that plasma. And the idea is that hopefully the antibodies that this other person whose plasma it was built up against COVID-19 will help you in your fight against COVID-19.
Recover faster. Okay, that is really helpful to know. What is the timeline? You said it is being in limited use right now under compassionate care. What's the timeline for broader treatment?
Well, I'm being told that clinical trials may start as soon as 3, 4, 5 weeks. It's very difficult to measure at this time, but I think it is a good sign that hospitals like Texas Medical Center or it's Texas Methodist Hospital in Houston is already using this technique. I think the more hospitals, probably within the next week or two, we'll start to see a lot of hospitals using plasma from recovered patients to try and rescue those who are still sick with COVID-19.
That is so interesting and valuable. I do want to take a tiny quick second. If you're watching this show right now and you think the things that Mark is saying are important to know about, feel free to just share the show. You can just press that little button and be like, this guy Mark is a genius. He's helping me understand what's at stake. I'm kidding, but I'm not kidding. Okay, Mark, my last question for you though is talk to me about chloroquine. The president talked about it a couple weeks ago. We know there were some overdoses, there was some hoarding. Where is this netted out this week?
Well, first of all, chloroquine is a second type of treatment. So there's plasma, but there's also what are called repurposed drugs. These are drugs that have been found safe for one purpose, and so they're trying to use them for another. Probably the best known example is sildenafil, which is sold as Viagra, erectile dysfunction medicine, but it's also used for pulmonary hypertension. Chloroquine is an antimalarial drug. Right now, the jury's still out on how effective it can be. I think the president may have jumped the gun a little bit. There's some results that are promising from China, but they've been very small studies, and scientists from around the country haven't seen the full data yet. So there's a little bit of cautious optimism to do with them. Chloroquine is actually one of now, I think, about 69 different drugs, repurposed drugs that have been, at least in an initial preliminary phase, deemed possible treatments. So there's a number of different drugs like chloroquine that are going to be looked at in the next few weeks.
Wow. So it sounds like people all over the country, scientists, doctors, people studying all these drugs and diseases are really trying to pull together all of their resources. Mark, I'm going to ask you to stay on for just a second as we continue moving through the show so that you can continue commenting and help us understand things. But I am going to bring up our colleague, Ken Altucker, who he's with USA Today, and he's been covering testing and status of testing across the nation. So Ken, first of all, you're home. How's it going?
I'm home. You may hear my dog in the background, so apologies for that. The dogs are being loud, 2 girls, and they're being great and quiet.
Oh, man, I know. So they're fully off from school for the year, right?
They are off for school for the year, and our governor in Virginia, where we're located, just put a stay-at-home order until June 10th. So we're snug in here for a while.
Okay, well, say hi for us. And we had that came down, or that's coming down today out here in Arizona as well. But for now, Ken, let's talk about testing. How's it going? It started slow.
Right. It was really a rocky start for testing, as has been well chronicled to this point. When the first case of COVID-19 came to the U.S. in the Seattle area in January, we really, as a country, we're not set up to handle this massive surge in cases. The CDC has traditionally had a role of public health laboratory testing. They developed a test. The rollout was rocky. The first testing kits sent out were flawed. That has since been corrected. And really what the difference now is a lot of private labs, commercial labs, as they're called, got the green light from the FDA, another government agency, about a month ago to begin testing. And with that, there's a lot more capacity out there, upwards of 100,000 tests or slightly more, according to some tracking websites.
Wow, 100,000 though is still not a lot considering there are 330 million Americans. So still plugging away there. Okay.
Right. That's a big issue. And right now with a lot of stay-at-home orders, testing is still limited. A lot of people who need tests aren't getting them. Doctors are still rationing these tests. per instructions of state health authorities, like in your state in Arizona. That's what they're doing. So there's still a lot of demand for testing, and it's going to take a while to catch up with all the people who want and need tests.
Thank you. That is nerve-wracking to hear. I do want to, again, I want to remind our guests, remind our reviewers, if you are finding this stuff useful and helpful, please share it with your friends and family. You can just click the little share button and let other people know that you are trying to learn about what's going on in America right this second, and empower your friends and colleagues with this information by sharing it right now. I'm going to go back to you, Ken, and ask, we've had some questions about these super rapid tests, that like everyone's trying to develop them. We've heard about a 5-minute test, a 15-minute test. Help bring us up to date with, like, what do we know? How available are these? Do they exist?
Right. For the most part, the commercial that I mentioned before, it takes a while to get results. You have to collect a sample, send it off to a lab. They have to process it. I mean, in some cases, they're working 24/7 to get all these samples processed. So I've heard stories, anecdotes where people have been waiting 9-10 days to get a result. Obviously, that can be frustrating given the current circumstances. But there are a couple of private companies most recently on Friday, a company called Abbott Labs that promises a test results within 5 minutes. It's limited capacity right now. They say they'll be able to roll out 50,000 tests in their machines. It's what's called point of care, where you go to a doctor's office like a strep test or a flu test where you get results right away. And that's sort of what they're promising here. And doctors and public health people say that's really critical to get those rapid tests, particularly as this pandemic continues on.
Continues to expand. Ken, I'm going to have you stay with us for just a second. Thank you for that response. I'm also going to bring back Mark Johnson, our colleague from Milwaukee. Hi, thanks for being on, Mark. We've had some questions in the comment, or in the chat. Either one of you could take this one, but people want to know, can the disease reoccur? Can you get sick more than once?
I think that's still an unknown right now. That's one of the things that people are studying. I think that they should be able to establish that within several months, but people who tell you
a long time from now.
People who tell you that it's known now, I think, are talking ahead of time, before they really know. The thing to remember is that this has happened very, very fast, and there's an awful lot more that we don't know than what we do know.
Well, thank you. That's sobering. We have another question in the chat about people are asking about not testing more early. We've seen a lot of countries in Asia got out in front of this, started testing rapidly at the same time when our government was like, it's going to resolve itself. Ken, can you talk for just a second about what that did to our capabilities?
Yeah, we had a really, some of my colleagues did a really great piece on this, how we really got behind the 8 ball on testing, because the whole one of the main functions of testing beyond knowing your individual status is when an outbreak like this begins to get a foothold in an area like Seattle, you need to know who's positive so you can take actions like isolate that person, let them recover without spreading the disease to other people. So that's really critical, because our testing capacity just wasn't there when cases started to emerge and the virus started to spread. In Seattle was the first major metro area, then New York, as it's happening now, and on to several other cities like New Orleans, Detroit, Chicago, Miami is a potential hotspot. So without having that testing ability to identify, isolate, and kind of tamp down the spread of this virus, it really kind of slowed the nation's response.
Thank you for that. Boy, you guys are just filled with sunshine, good news. No, I'm kidding. But you do have a lot of good news. Like what I'm hearing is we're testing more people every day, that treatments are in the pipeline. I'm going to ask both of you to stay on the show, and we're going to bring up our next guest. So thank you for sharing with us, gentlemen. Our next guest, thank you so much for being on, is Dr. William Trank. He's the Chief Medical Officer at Humana, who is coming to us from Louisville. How are you, Dr. Trank?
Hi, I'm actually outside of DC with my family right now.
Oh, I'm sorry. Your corporate headquarters are Sorry, in
Exactly.
Kentucky.
Exactly.
Okay, well, who's with you home today?
I'm with my wife and my 9 and 12-year-old daughters. I've learned a lot about my inability to compete with my daughters on traditional board games.
Okay.
Almost statistically improbable how few games I've won against both of them over the last
Now
couple.
you have to start teaching them card games that only you know how to play.
Well, I do need some coaching. That's clear.
That's really funny. Well, thank you for telling us a little bit about that. I know it's intense to be home with everybody, and be working from home right now. So thank you for joining us this afternoon. I know you had some news over the weekend with Cigna and Humana. You both announced a new policy about. So talk to us about your announcement this weekend.
Yeah, well, we announced that we're eliminating all cost sharing, deductibles, copays, coinsurance for the treatment of COVID-19. The argument is that at a time where there is incredible anxiety and stress, both in terms of our economic stability and in terms of our health, the last thing we want is for anyone to be worried about their finances when they're combating this disease. We wanted to take that issue, that financial issue, off the table. So by doing this, we now have fully covered the testing, the services around the testing, and now all the services around treatment. So at least we have removed finances from the list of concerns for our members in the setting of this pandemic.
Man, thank you so much for that. That feels like a really very powerful statement from both of your companies to say it's so important to go out and get tested, because knowing your status is a huge part of stemming the spread.
Yeah, that's right. So we know that people avoid treatment, avoid testing because of the finances.
Mm-hmm.
And that is bad for our members, but it's also bad for society at a time where we really need more information and we really need to be able to identify and appropriately manage those who are infected.
Well, thank you for that, because it goes right into our next question, which is, so many of us who are lucky enough to have insurance know that you have to stay in network. And so my next question is, how are you guys managing, church parking lots and drive-throughs as in network?
Yeah. No, it's a really good question. It's particularly poignant at a time where, as our other guests have been noting, are challenges around access. There aren't enough tests for everyone. And it is our obligation as a payer to make sure that our patients, our members, have access to the tests they need. So if there are no in-network tests available, then we have to make it available. We have to make out-of-network tests available for our members as well. And in those settings, we are still offering, we are covering with and waiving all co-payments, co-insurance, and deductibles, so that, again, the finances should not be any impediment to people getting tested.
Understood. Thank you for that. Speaking of other things that insurance companies are doing, and especially you guys, we were talking about telemedicine availability. If we're supposed to stay home, people are nervous about going into hospitals or even minute clinics because that's obviously where other sick people are, or other people with other problems. So talk to us about telemedicine availability and coverage.
So I'm glad you brought it up. I think it may end up being, telemedicine may be one of the really transformative pieces of our healthcare system throughout this pandemic. We know that if we have a patient or a member who is potentially infected but not that sick, the last place we want them to go is to a clinical setting where they're going to be exposed to others, potentially expose others to their illness if they have it, or if they don't have it, to be exposed to others and potentially contract the illness. The goal is to keep folks with coronavirus isolated and separated. So staying away from clinical settings is so critical. So we've offered a number of approaches to try to make telehealth more available. We have vendors for each of our main products that can serve as an urgent care resource, MD Live and Doc on Demand. But more importantly, we've opened up we've opened up the opportunity for everyone's doctor, a primary care doctor, a specialist, a behavioral health physician, to call their patients just using a cell phone. We will pay the provider the full cost that they would have charged us had it been a face-to-face visit, and we are eliminating all cost sharing for our members. The rationale here again is that we have a role to play by leveraging the right set of financial incentives and policies to keep our members safe and at home, and to reduce the spread of the disease. And telehealth, we think, is a really critical way. It's interesting to note, though, that if you look at the most progressive primary care practices that we work with, primary care practices that focus on vulnerable elderly and have developed more progressive care management policies, we're seeing that they're reporting, on average, that about 90 to 95% of their visits now are being conducted via telehealth. 4 months ago, the answer that number was 0.
Wow, so that is a huge change.
Transformation. It's a huge change.
So I do want to, and I know this is a lot of, is this an industry-wide goal? Like, are you seeing your peer companies make these kinds of pivots or talk about these kinds of pivots?
Yeah, I mean, we are certainly not alone. We all recognize that there's a clear set of guiding principles here that says, let's keep patients away from providers, let's keep patients away from other patients, let's minimize the spread of disease. The rationale for using telehealth is entirely straightforward. But it will be interesting because I'm not sure we're going to end up returning to, the status quo pre-coronavirus after we've learned the value of this patient-centered, convenient, new way of delivering medicine.
That's really interesting. I appreciate that. I know I've used it for myself. I've used it for my kid. The only thing my doctor's office says they won't do is they will not diagnose a rash over the phone with babies. They just say it's impossible to tune in on that. I do have one more question for you as we continue on through this conversation, which is, I know many of us are saying stay home, don't go out, but we know that loneliness and a sense of isolation is an incredible, it has a huge factor for morbidity. So talk to us about some of that, how you are responding personally, how the health insurance industry is responding.
Well, I'm really glad you asked. And I think every one of us is struggling with this in one way or another personally. I know my parents are both around 80. They would not describe themselves as elderly or fragile, but they're around 80 and they have a number of medical problems. And they're very much at risk during this time period. And it's essential that they follow the guidelines and that they do socially isolate because they are at tremendous risk. And that social isolation it has an impact on them. It has deeply impacted their way of life. And, when you get to be a certain age, some of those flexibilities around finding new ways of living are a little harder. So we try different tactics, different strategies to try to keep them engaged in new ways. We call them regularly and try to get our grandkids involved. We tell them not to watch TV all day because that can raise a lot of concerns. We recommend that they go out and get a little walk in, and we recommend that they call people who they think are in most of need of help so that they feel like they're participating and engaging. The goal, I think, is really to somehow try to maintain some sense of a new normalcy, that there are things to look forward to and conversations that they can stay positive about, and ideally keep their spirits and energy up so that they can come out the other side even stronger.
Thank you for those insights. Those are all things I know so many of us are thinking about doing too, much more regularly checking in with our loved ones, because we know we're not necessarily going to go up this weekend to visit, but we have to call more often. Thank you, Dr. Schrank, for that. I want to bring up Ken Altucker, one of my colleagues. We were talking about a couple things earlier. You were talking about coverage. Ken, you had a comment for Dr. Schrank?
Oh, yeah, this thing is moving so rapidly. Early on, we heard from people who were concerned about things like costs of X-rays or MRIs if they show up to an emergency department at a hospital, and what type of responsibility they may have financially. Are you seeing any of that?
Well, there are certainly the workup for a patient who's being evaluated for coronavirus is more than just a lab test, particularly somebody who's symptomatic. They're going to need an X-ray. They may need a CAT scan of their chest. They're going to need additional labs. And that's all part of that initial treatment visit. We do, our plan, our stated approach is that we will cover the entirety of that visit, regardless of what is ordered. We are hoping that folks stick to the evidence to make really good, thoughtful, evidence-based decisions about what are the right kinds of tests to order. But we at this point believe and trust wholeheartedly and holistically the providers who are out there really doing God's work, risking themselves, risking their families to try to take care of patients. And frankly, our goal is to get out of the way. We do not want to interfere with the way that they treat patients with coronavirus. As a result, we've eliminated our utilization management, our prior authorizations, all of our administrative requirements in the setting of management of a patient with coronavirus to make it easier for the providers to just do the right thing and not have anybody else any other phone calls to make or any other administrative issues to try to handle. Our job is to support as wholeheartedly as we can the providers who are doing the very, very best work that they can to help our members, their patients, be healthy.
Dr. Schrank, thank you so much for that answer. Ken, thank you for your question. We're going to have a little bit of a tonal shift right now, but I ask all of our guests to stay on with us because just as we are talking about supporting our healthcare brothers and sisters, so many of us in our communities are thinking about our neighbors who own and run the small businesses that make our hometown so interesting. The Small Business Association said that on average, a small business has about 26 days of cash on hand. And that is a lot. That's like an average. So we know some people have far less and maybe some have more. And so now that we're in our third week of general lockdown for most communities, I think 3/4 of the nation have kind of stopped going out to eat, at least, if not much more drastic. Things are getting tight. Now, last week, we talked about how the stimulus package has a lot of resources in it for small businesses, but they still have to learn how to navigate all that. So we're bringing on, our last guest today is Chris Bianco, who owns several businesses in the greater Phoenix area, but notably, he has 94,000 Instagram followers and a new YouTube channel in which he started to turn to social media to create community and keep his shops open. So Chris, first, I can see you're in the shop. How's it going?
Well, it's a quiet shop today. It's just me today, and we have like 2 people inside. But it's just it's a very, like for all of us, a very surreal world. And we like our business shifting from not really a takeout situation like in our pizzerias. And I've been open since 88, and we were mostly dining restaurants. And so now it's like shifting that focus and along with that, we lost about half of our staff. Our hours are very limited. We're constantly now, monitoring, just who's getting enough rest. Like for me, normally I'm in about 6 days a week, sometimes a 7th, just to come in and check on things. But I'm trying to stay out of the restaurants, even to come by, maybe 3-4 days a week. To be. So it's the new normal is. We're listening. I think, you mentioned, the YouTube channel, up until 2 weeks ago, I never, posted anything or thought I had anything to say, but I felt compelled by, that I was confused as anyone. And I didn't come on with really the answers. I came on with talking about help me understand, like listen to Dr. Sanjay Gupta or Fauci, Dr. Schrank, and I would say thank you so much. First of all, I'd be remiss if I didn't thank I'm always amazed at doctors. Just like a pilot after a bumpy flight, you have a new appreciation for pilots. Well, I have always had an appreciation for our medical professionals, but today, I think, you're seeing, the incredible superheroes that I hope that they're never forgotten in this. So,
well, Chris,
yeah.
I mean, you're emotional now, and you were quite emotional in your first couple sort of big social posts. And I know that you have a lot of followers, you have a lot of influence, but at the end of the day, you have to sell food to stay in business. So I do want to ask you, like, how does posting to social, how does that intersect? How does that help? Or does it just help you be there for your people? I mean, maybe it's not so much about selling pies.
I think the one thing about being there for our people, I think, we're here for each other. I mean, I start with my team first. I would say other people tell you who you are. We tell people, who we want to be. And I think, I want to be there for my people. I want to do these things, but if my people aren't feeling it and they're not living it, then it's a mirage. So I think as much as we can, talking about, what our day looks like, what our challenges look like. Now there's a stimulus package, but we've been in business 30 some odd years, and we never, got anything from the government. We show up for when there's a hurricane, a cancer, a fundraiser. We show up with pots and pans and fire and food, and we cook for people and we raise money. So it's a very, awkward position for us to be waiting for the help, so we can tell people that've been with us for so long that don't freak out just yet. Stay calm, stay healthy, stay home, and we're gonna be able to take care of you. And what you said about the 26 days, I mean, I think most restaurants, especially ones that take care of their people, look at providing at least a portion of healthcare, use organic ingredients, support. I would say most of them are probably on a 12-day cycle of being here or gone. And, there's a holistic approach to, like Dr. Shank mentioned, and I think right now we're on a kind of, micro kind of, what do we do right now in this moment? And as we get through it, I'll have a lot of questions to ask. But, for us, even with the takeout, it's been, it's like, 20% of our normal sales. We're losing, between all the restaurants, about $10, $12, $15,000 a day.
Holy cow, Chris. Wait, but just a second. When you mentioned that, like, some people only have, so we've already run out a ton of people. If it's 12 days, we're now on day like 19 for a lot of businesses that they've been shut.
Yeah.
They close their bars immediately, which we know is like their biggest revenue. Those are
our bar closed immediately. We have Bar Bianco that closed immediately with no takeout, obviously. But I think a lot of the thing is, a lot of people won't be back after this. I mean, this is a real harsh reality of what do we do now? I mean, it's so weird. We were in a crunch, 2 months ago. There was no, we couldn't find, employees.
Couldn't find anybody to hire, yeah.
Our workforce was, diminishing. And now, 3 weeks ago, we're in tears telling these people that not only we have no work for, that we might not have another check for them for a while, and go to unemployment and hope that those long lines reach your family at some point. So there's, and then lastly, again, our community has been amazing. They're amazing, but our community is a blue collar community. And I think we're in a position, my 3 kids are at home with my wife, who's about to pull her hair out if she hasn't already. Even we love our kids, we play games. They, their kids drop off their home, we pick up the homework. There's going to be a time right now where part of this, even our community's capability to be philanthropic is going to run dry. Like, getting takeout and some of those things, like, we're looking at now, making soups or stocks, or how can we, prepare for the next level, which would be, our pantries that are full, so our families can help sustain as their ability to be philanthropic and helpful to the community and self-sustain happens. So a lot of
Man. Chris, I hear you, like, in real time, thinking about how to pivot to the next idea about, like, being there for your community, and your sense of, like, determination and survival is, we're kind of running out of time on the show, but I do want to leave it there because it is really uplifting to hear you talk about that and say that, like, if it's not pizza, it'll be something else because you want to be here for your people.
Well, I say the last thing is help me understand, and I think me represents a lot of people that just grind every day. They're now confused, and we're doing the best of our ability. to get through this and bring many people as we can with us. So we can go
Thank
on
you.
Bianco TV, shameless plug, and we'll talk about it.
Okay. It's okay, Chris. We knew. Thank you for that. It's not shameless. It's helpful. Thank you so much for being here. I want to bring up the rest of our guests and say thank you so much for being on today's show. I think it was pretty serious conversations today, gentlemen, so I appreciate you helping to help our audience make sense of so many things that I know the news is breaking faster every day, and there is so much information and sometimes misinformation that we're lucky to have you here. Thanks for tuning in.
Thanks for having us.
Thanks for having us.
Thank you so much, everybody. Thank you.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.